America spends more money per capita on healthcare than any other nation on Earth. You would think that this expenditure would guarantee the best care in the world. That is not the case. In fact, despite being the most expensive healthcare system on Earth,
we have poor outcomes relative to other countries. We pay twice as much as any other country. We pay more and get less.
We pay higher and higher premiums every single year, but one way or another, insurance companies are devaluing our policies, and that's what this rage is all about.
With companies that already make a lot of money claiming they're going to provide you health coverage in the event that you need it, and when you need it most, they deny you. The rich are also getting richer against this backdrop. I want to show you just one headline. There are many out there, but when you look at the hoarding of wealth by a small group of people, Bloomberg, the financial outlet, notes that the world's 500 richest people are now holding $10 trillion in wealth this year. And if all boats were rising in this tide, you might have a different dynamic or reaction to that, even though that is an incredible amount of wealth hoarding that can't possibly be spent in those people's lifetimes and likely the lifetimes of their children. But when you look at the raw national data, which we have from the federal government, the median wage an American is making is just over $1,000 a week in the first quarter of 24, which doesn't get you very far, and that's before you run into unplanned health costs, which might be the thing that saves or doesn't save the life of you or your loved ones. Americans have very few options against rising inequality and a heck of a lot of understandable rage about the people at the top doing this.
Billed our insurance company over $3 million for the cost of transplant. I don't know what people do without insurance. How could you even begin to pay that?
She said the bill is up to $80,000 already, and she said, Mrs. Weinkauf, I hope you realize that you're responsible for this bill. I thought, what am I going to do? I've worked my whole life. Is this how my life is going
to I refer to those barriers. One in particular is refusing to pay for medically necessary care. There was a case involving a 17-year-old girl in Los Angeles who needed a liver transplant, and a medical director for Cigna 2,500 miles away said he didn't think it was medically necessary. The surgery had been scheduled. A liver had been found that was a perfect match for Natalie Sarkeesian. But Cigna said no, it wouldn't cover it. And eventually, Cigna caved to public pressure because it became a very highly publicized case, and it became a big PR problem for Cigna, and Cigna eventually agreed to pay for the transplant, but it came too late. Delays can be lethal, and these companies delay needed care all the time, and that was the case for Natalie Sarkeesian. She died just a few days before Christmas in 2000.
Last month, the 79-year-old got some jaw-dropping news. Her insurance company, United Healthcare, is cutting 4 of her 6 physicians from its Medicare Advantage plan, including her most trusted doctor, Dr. Lawrence Michkowski, or Dr. Mitch to patients like Jody. The cardiometabolic specialist will be unceremoniously dumped from United's Medicare Advantage network January 1st with little explanation.
Average American life expectancy is lower than other wealthy countries and has actually begun to decrease in recent years compared to other countries slowly increasing. The U.S. has the highest infant and maternal mortality rates of any developed country.
I see people when they're at their lowest, when the system has failed them, and I'm frankly not surprised. They feel abandoned, they feel exploited, they feel lied to when it comes to the healthcare system, and especially insurances, because of the things you mentioned, denials, prior authorization, narrow networks, the cost of healthcare. It's been going on and bottling up for a long time.
This comes as a study finds about 7 in 10 adults say that denials for healthcare coverage by insurance companies or profits made by health insurance companies also bear at least a moderate amount of responsibility for Thompson's death.